Okay, thinking about making consequentialist um, assessments about benefit and harm to a patient. The text tells us that we have to think about these things in terms of subjective and objective. Those words have a bunch of different meanings, and they can oftentimes be very tricky to get a handle on. So I just want to say a few things about them here. First of all, there's a meaning of subjective, which means more or less situational. When we say probably all medical decisions are going to be subjective, meaning there's not one answer for every situation. You have to look at the situation. Subjective here means something more like relative. Okay, although, I mean, we can use the word generally. I'm not trying to correct language, okay? But we have to be attentive to what we mean by using the word. When we turn to the topics of this chapter, subjective is being used in a different way. It's being used to how the benefit and the harm is assessed. So subjective, I spelt it wrong there, means from a subject. And a subject is a person. It's you or me. Okay, so a subjective assessment of benefit or harm is not subject to something. So don't get thinking that way, but rather it's something made by a subject. Aren't they all made by a subject? Yes, they are. But again, we have to make a slight distinction here where we can talk about assessments that are based completely on the subject. And those are subjective Hippocratic utility, assessments that are based on the perspective of the one making the assessment. Now, objective Hippocratic utility is not exactly the very opposite. Rather, these are assessments based on perspectives outside or other than the one making the assessment. So if you're looking for a way to think about and keep in mind subjective versus object, so think about subjective here as coming inside of you from your thoughts, your feelings, and think about objective as being outside of you. And insofar as we get other perspectives outside of us, in medical decisions, those might be the patient's perspectives, might be other docs, might be other constituencies, insurance companies, hospital administrators. Okay, now these all might be subjective from their point of view, but from the point of view of the person making the assessment, here usually the doctor, they are objective. They come from someplace else. So the question here about utility, and utility simply means an assessment of benefit as harm, is how are you going to make it? What are you going to pay attention to? Okay. Some people think all of these assessments must be subjective. And that might be subjective in a different sense, where you would simply make it up, okay? Something could be subjective and not made up, okay? Maybe there's an example here in the case number 10 where the physician has a rule of thumb, he says, about hysterectomies. When in doubt, do one. Now, that's not made up. It might be kind of a summary of that physician's experience, but it's subjective nonetheless because it's never been tested against or tempered by anybody else's perspective. Those that disagree that all perspectives must be subjective don't necessarily think that they're all totally objective. They might think they're a little bit of both. They can move off of subjectivity, pure subjectivity, move into something that's more objective. Okay, many people believe that our medical assessments should be that way, okay, and not just simply subjective, okay, and those people, if they do believe that, they are rejecting the Hippocratic Oath, because the Hippocratic Oath basically requires physicians to make medical decisions in terms of dietary regimes in the old oath according to their ability and judgment. And again, you might read over that quickly, not paying a lot of attention to those words. I mean, they're not really all that important, but they are important. I mean, when they says according to your ability and judgment, if this is setting up a moral obligation, then we have to read it carefully when it's saying that I need to make a decision. I should not be paying attention to what other people think, whether they're other doctors, whether they're my patient, whether they're an insurance company. Not only do I have a right, okay, but a duty, a job. It's my job to do this as a doctor. And that is really the essence of the Hippocratic oath and the Hippocratic Ethic and the Hippocratic tradition, which we are going to do some work on trying to get that out of your head, that we just can't live with that anymore for a lot of different reasons.